Good morning, everybody. Uh, we are going to do one step ahead in our certificate course of palliative care, which is a 12-week course. And in the earlier lecture, we have discussed the importance, basics, need of palliative care. Now we are going to talk a little further. We are going to understand the social support system. What is the social support system which is in place for giving a good quality of palliative care? Let us discuss this. What is social support? Formal support. There are hospitals, there are palliative care clinics, ASHA workers, NGOs, and social welfare department of the government. These are the formal support system. What is informal support system? Family, number one. Neighbors, local spiritual leaders, community groups. They are the informal. What is the government schemes? Health cards, just like Ayushman card, like that. Disability, pensions, caregiver, grant, and Ayushman Bharat. So, learner's job, make a visual map of support level like individual, family, community, and institutional, and describe their specific role in caregiving. So, you have understood the formal and informal support system available in the society for palliative care. Now, step-by-step method to access the support. How you can access? Identify the patient need, number one. Number two, search and connect locally. Number three, documentation and follow. There are three major steps which is important for deriving the support which is available in your area. So, patient need can be for physical, financial, emotional, and spiritual. Physical means equipment and transport is required. Number two, financial subsidies if the government or any NGO or any philanthropic society, and insurance if they have the insurance covers it. Emotional, counseling and peer group, and spiritual, rituals and traditional healers, rituals of that patient, society, a patient family and patient belief has to be. And search and connect locally. Visit primary health centers or district hospitals and connect your patient with there. Get them registered with the primary health center so that they can derive the benefit of the government from time to time. Approach local NGOs and palliative societies. There are many NGOs, philanthropic organizations, which are helping such kind of patients in all the four aspects. They can be approached and will get connected to your patient and the family. And use the government helpline. 104 is the government helpline in India. You can use government helpline if the patient is in urgent need of any support. And third is the documentation and follow-up. I told you earlier in slide that the research is a very important part. So documentation helps in the research. Why? Because you are documenting the response of your treatment, and that documented data can be used for research purpose. To help the patient, family prepare ID proof, number one. This is documentation different, but I'm talking some additional to this. What additional? Data collection of response of palliative care. But here for the patient benefit, prepare the ID proof. If somebody is lacking Aadhaar card, get it prepared. If somebody is having the Aabha card, get it prepared. Help the patient in getting these kind of cards. Okay, and then register for schemes like NPHCE. This is a scheme for the palliative care. Register the patient in under there. By a registration, a lot of facilities can be obtained to your patient. And track benefits and follow-up. Track benefits and follow-up. This is important, as I told you in the beginning, for your research documentation. So now, the community-based integration model. Integration of social support plan. What is community-based? Step one, assign a local health worker as coordinator. Number one. Number two, form a WhatsApp group. Patient, caregiver, ASHA workers, and volunteers. All the four are involved with this patient, health worker coordinator. Schedule rotating home visits. Because you know that everybody cannot visit at one time because everybody is not free. And there are many patients on one patient, one nurse, or one Ayush doctor, one volunteer. So schedule a rotating home visits. Nurse, one day nurse is going. If urgency is there, anybody can come. But if there is no urgency, then they have a schedule. So on Tuesday, nurse will come. On Wednesday, this Ayush doctor will come. On Saturday, volunteer will come. Sunday, they will come. Like this, schedule it. Use the local panchayat and temple for community meeting. And the patient can attend the temples and the panchayat meetings, use the local facilities for this. This is recommendation is based on the WHO community-based palliative care toolkit and ICMR guideline 2020. It is a standard method we have to adopt. This is important. Comprehensive patient needs assessment tool. How you will assess what is the need of your patient. I have told you in the earlier slide, physical, financial, emotional, and spiritual. There are the 4 domains where patient care has to be given. In the physical, pain, mobility, equipment, and nutrition. Assistive devices or medical supplies. And then transportation for appointments. Suppose you have appointment in a hospital, there should be ambulance, there should be a person helping the patient. Is this kind of support. Financial support, cost of care, income level, and insurance. These things. Emotional support, mental health and caregiver stress. Is the family and patient both. Access to peer or counseling support. And spiritual, belief system, meanings, rituals, need of spiritual guidance or practices. So this is the assessment area. An example how you will do, most of them are having questionnaires, very standard scheduled questionnaires, you can use them. Do you feel pain or discomfort? Yes or no? Give the detail. Do you need help moving or eating? Like this. Do you have access to walker, oxygen or adult diapers? Can you reach the hospital, clinic when needed? These are the physical requirements. Financial, are you struggling to afford your medicine or food? This is a question. Yes or no? Answer. Are you enrolled in Ayushman Bharat or NPHCE program or pension scheme? Yes or no? Mental health. Do you often feel anxious, sad, or helpless? Is your caregiver stressed? Yes or no? Rate them scale 1 to 5. Do you have someone to talk to about your worries? Yes or no? This is emotional care. Okay? Do you, your spiritual or religious need feel supported? Yes or no? Would you like to connect with a traditional healer or a priest? Yes or no? For this scaling, I have given you the idea. Simple yes or no or score 1 to 5. When 1 is no issue, 5 is severe need. Prioritize need which score more than 4 or no. Response to key access and question. Use responses to build a customized support referral plan. So these are the domains where you have to ask questions. These are the questions which have been figured out here, and this is the answer which you will expect. Depending on these answers, you will score them and then customize support referral plan. You will make it. Primary health centers, what they will do, in all the 4 domains I have told you, provide essential palliative medicines like painkillers, antibiotics, etc. These are the free given in the primary health care. If your patient is registered with the PSC and if they have these issues, they can be taken care by the PSC staff. Arrange physiotherapy, wound care, and basic investigations. They all are done with PSC. Central BPL, below poverty line, status for access to Ayushman Bharat and state health schemes. If you are below the poverty line, most of these facilities are free of cost to you. So this reduces the financial burden. May provide basic mental health counseling or referral to district psychologists. There are the district psychologists appointed by the government, and they are covering more than one PSC. In the district there is one, and there are suppose 50 PSCs. So he will look after the patients registered in all the 50 PSCs, but you have to register. They will give you the appointment, and on that day you have to bring your patient for PSC. And spiritually may allow collaboration with local religious leaders in care units. This can be done. So step-by-step practical approach for rotating home support. I have told you in the beginning, nurses are there, ASHA workers are there, social workers are there, volunteers are there, but how to rotate them? This is important. The primary role is the medical monitoring, main done by the either Ayush doctor or the nurse, medical monitoring, and then symptom relief by the doctor only, and hygiene and education can be done by the nurses and the volunteers. Weekly task, check vital parameters like blood pressure, pulse, temperature, wound care, whether dressing is going on or not, bed sores, check it, because the bedridden patients very often develop bed sores, and if bed sore is developed, it has to be healed very carefully, otherwise it is very painful, very painful. So we have to take care. Administer injections or support oral medicines. If they can take oral medicine, well and good. If not, if the patient is very serious and not able to swallow the pills, then we have to go injections and injectable things. Take basic caregiver practices to family. Technologies can be used for this. Monitor nutrition, hydration, and side effect of the medication. 3 things we have to monitor weekly basis, okay? And refer if complications arise beyond home care. Patient is in home, but you are weekly monitoring all these things, and if you find the patient needs hospitalization or better consultation, you have to refer it to the PSC or to the district hospital. Step by step, the Ayush practitioners, what Ayush practitioners can do. Earlier I have told you proper allopathic PSC's care. This is allopathic, and now I have written allopathy trained ANM. Now I am coming to the Ayush practitioners, holistic wellness, symptom management, and preventive routines. They are the primary role of the Ayush practitioners. It can be Ayurvedic doctor, it can be naturopath, it can be yoga practitioner, yoga guru, and weekly prescribed herbal decoctions, rasayanas, and mild Ayurvedic formulations to manage fatigue, insomnia, and constipation or diarrhea, whatever, GIT problems. Conduct yoga and breathing exercises for patient and caregiver, both needed. Because this is the yoga which is taking care of sympathetic nervous system and parasympathetic nervous system. Both have to be, both are taken care by yogic practices and breathing exercise. Take daily routine, teach daily routines, Swasthvritta, in Ayurveda it is called Swasthvritta, which covers sleep, bathing conditions, food habits, timings. All these things are covered under Swasthvritta. Is a chapter given by Charakshu Samhita, and that has to be followed. An Ayush doctor will recommend this teaching. And recommended dietary changes based on the Prakriti and the disease stage. Because in Ayurveda there is a Prakriti, Vata, Pitta, and Kapha, and the diseases are also grouped under Vata, Pitta, and Kapha. So based on that, some what to eat and what not to eat, there is a prescribed protocol for it, and Ayush doctor will recommend it. This will also be very helpful in patient overall health condition. Now, step-by-step approach by rotating home support, community volunteers. In the first slide, I told you that what allopathy doctor will do. In the second slide, I told you what Ayush doctor will do. And now I am telling you what volunteers will do in rotating. The main goal is the social, emotional, and logistic support they have to give. How they will do weekly task? Ensure medicine supply if they are getting from hospital or from anywhere, this medical supply, food security, and transport arrangements if they need it. Provide companionship and emotional listening. Help access document for welfare schemes like Aadhaar card, Ayushman Bharat. These are the volunteers can do it. There is no need of Ayush doctor or allopathy doctor. The volunteers can do it. And assist in creating local support group or WhatsApp circle around the patient so that anybody in that group can come and take care of this emotional and logistic support or social connections. Maintain a weekly visit log and report needed to needs to nurse. Visit log means there should be a register where a volunteer has come, he has talked to the patient, he has noted his observations and he has indicated what should be done. The next time he comes or somebody else comes in between, they can take care. So a log should be maintained. That's very important. So visit log sheets, referral directory, form for schemes and mobile phones. They are the tools which can be utilized by a volunteer to give, so for deliver the role as a social requirement, emotional requirement and logistic support. Now, the sample rotational schedule, repeat monthly. Earlier I have told you weekly, now I am going to monthly. Nurse, Ayush practitioners, community volunteers and nurse plus Ayush combo. Vital medicines and training. Lifestyle, pain relief and yoga. And logistic and emotional support. Review plus new plan. These are the focuses of these visitors. I have told you by rotation on monthly basis they will make their plan. Coordination plan. Create a shared Google Sheet or notebook for patient record, because all people, they are the stakeholders of the one team. But team people are different. There are 4 people, there are more than 4 people, but they cannot talk to each other, but they can record their observations, what they have given in the shared Google Sheet. This is very easy, it can be maintained. And the WhatsApp group is also now very common. And assign a case coordinator. One of them should act as a coordinator, overall coordinator, often the nurse, for oversight. And set SMS, WhatsApp reminder for visit days, because it is a monthly program, you may forget it. So use the calendar to schedule that you are going to see patient on that day. The conclusion of this talk is there is a scientific approach to manage support system without giving burden to any stakeholder. This is very important. Everybody is there to help you, but they should not feel burdened. You have to take care. A planned rotation of all stakeholders would be helpful to provide best palliative care. And lastly, the involvement of existing government support is essential while planning the overall support system. With these words, thank you very much.